next question will be going to Dr. Jim Kim. So Dr. Kim, while you were at the president of the World Bank, you oversaw the bank's response to the Ebola response epidemic in 2014 to 2016. What advice do you have in supporting the LMICs in their response to the current and the future pandemics? And do you see a role in investing surgical systems?
COVID has exposed what we're willing to spend in order to deal with what is basically a health problem. And so in the G7 countries, I just addressed a group of G7 speakers, and the figure across the G7 countries was $6 trillion for fiscal stimulus and an unknown cost beyond that in terms of monetary policy, what the central banks have been doing in order to shore up the economy. So in the face of a public health problem, there's no question that the wealthy countries are willing to spend to the tune of $6 trillion. Now, if in fact they had invested in public health systems, something that everybody on this call have been advocating for, we would have had to spend much less than that. All you need to do is look at China, Korea, New Zealand, Australia. Some countries were lucky, being islands. Other countries had seen this before and were prepared. And the G7 countries, for the most part, unfortunately, were not. Some are stepping up. Now, when I was at the World Bank Group, the last two things that I did before I left, one was something called the Human Capital Project. And in that, we showed that investing in health and education is in fact correlated to economic growth more strongly than anything we had seen, more strongly than infrastructure, more strongly than any of the other things that most countries borrow from the World Bank for. It was shown that just 4 indicators in health and education correlated more strongly to previous economic growth than anything that we'd seen. And so to prevent future disastrous expenditures, like the $6 trillion in the G7 countries, and in order to promote growth, investing in health and education, and in this case, health especially, is important. Now, in terms of surgery, I think there's in the United States, it's never been more clear that something like COVID will flay open and expose all of the inequalities buried in the healthcare system. So in fact, while there is plenty of surgical care available in the United States, because it hasn't been done in a way that you guys, Key, Gail, Dan, you guys have been proposing, integrating it with health systems in a way that improves your overall health, what we're seeing is that people who have poorer health are dying in much higher numbers than people who are in good health. So I've been very clear. I think surgical services are critically important. There's so much of mortality and morbidity that's related to surgical care, and this is a fight that I've been working on with Jimmy through a lot of our careers. And what we've been saying is just the bare minimum for poor countries is not ethical, it's not moral, but it's also just not practical and not cost effective. You've got to invest in the full scope of healthcare, and surgical care is an integral part of it. By the way, I was with you guys when you first started surgery. I love the G4 Alliance. The fact that you brought all those groups together and the fact that you brought everyone together, this is really, really exciting. It feels like I went to sleep for a while. I woke up and you guys are pushing forward. We have got to take advantage of this moment, all right? It's been exposed once again that a few $100 billion for healthcare can save us from spending trillions of dollars in the future. And for the countries, it's a very specific recommendation. You need to go ask the World Bank. The World Bank will always say, well, it depends on what the countries want. So the countries have to demand that they have the full scope of services. Why did the US spend $3 trillion? Because the politicians couldn't go back to their constituents and tell them, I'm sorry, you're out of a job, you're out of luck. If there's pressure from citizens, leaders will change.
And John, you led the Lancet Commission and its report on global surgery. You produced that landmark report that is so frequently referenced by all of us in this initiative. What would you say is the current situation of surgical capacity in low and middle income countries?
Gail, thank you. It's great to be here, and thank you for inviting me. I think what I'll do very quickly is try to give a little context in terms of the history and where we've come. So if you think back to 2008, that is when Jim Kim and Paul Farmer wrote that, what is now a classic article that talked about the neglected stepchild of global health. And that was such a vivid metaphor. It's interesting how that really galvanized our community. And we went to work, and we all know that 2015 then was quite a big year because of the effort of everyone around the world. DCP3 was published, the Lancet Commission, WHA 6815. And to speak specifically about the Lancet Commission, you brought that up, that did a number of things. So it identified a clear vision, key messages, indicators, and also this concept of national strategic planning. And that's been brought up several times. And that, part of that came about because of a comment actually that Jim Kim made at the first Lancet Commission meeting, where he said that, global surgical care is an indivisible, indispensable part of healthcare. So that recognition that it really needs to be integrated into healthcare, it's not a separate thing, it's not a vertical project. So this whole concept of national surgical obstetric and anesthesia planning really speaks to that. It's a strategic approach to integrating surgery, OB, anesthesia, and trauma into a national healthcare system. As Jimmy Colker mentioned that this needs to be a government-led strategy with all stakeholders. And he mentioned that the devil is truly in the details. And that is what a national surgical strategic plan is. And so when I look back at the last, say, 10 years and what we've done well and what we need to do, I would mention three things. So one, how do we incorporate this concept of surgical strategic plan into national health priorities? And we've done a pretty good job of that. And you'll hear a little bit later from leaders like Emmanuel Mukasa and Emmanuel Ame, who have led those processes in their countries. And that leadership has led to regional approaches. So the South African Development Community, the Pacific Islands, et cetera. Number two, how do we attract financing for surgical capacity building? And I think that's something that maybe we haven't done as well as my number one priority there. And that's going to require that we talk to a different group of people. As physicians and surgeons, we're not used to necessarily talking to finance folks, but we need to get outside of our little bubble. And then number three is how do we integrate this narrative into the discussion around pandemic preparedness and global health security? So again, we can't stay in our little bubble. We need to talk to a different community. By and large, the pandemic preparedness, global health security community is obviously different than our global surgery community. So we need to get comfortable speaking with them. So number one, we need to continue our efforts with integrating surgery into national health planning. Number two, I think we need to be more proactive with financing. And number three, we need to reach out to our pandemic preparedness and global health security communities.
Oh, that's great, John. Thanks for that beautiful summary. We could potentially have massive sums of money allocated towards pandemic preparedness in LMICs, earmarked towards health systems strengthening, possibly surgical systems. That's to actually execute this kind of flow of money, that's a massive amount of work. And in January, there was an announcement that a global surgery foundation was created at the World Economic Forum. That's what the announcement was. And this was housed in UNITAR. And Jeff, you're the executive director for this. And so how do you see the role of Global Surgery Foundation as potentially the custodian or the implementer of such a fund?
So greetings from Geneva, Switzerland, and the United Nations Institute for Training and Research and the Global Surgery Foundation. Before I get deep into the question, let me just re-summarize what the end goal we could look at. And as discussed earlier with some of the panelists, we want a strong, sustainable, resilient healthcare system that will be ready to deal with future emergencies, such as the COVID pandemic. And the present pandemic has shown the weaknesses. I know that all of us participating today would strongly agree that surgical care is one of the keys to achieving this goal. And I've seen on the front lines how surgical care systems serve as the cornerstone of the foundation of resilient healthcare systems. This, of course, includes all components of surgical care, like Emmanuel said, anesthesia, strong nursing capacity, proper equipment and infrastructure, blood banks, oxygen supply, capable radiology, lab, pharmacy, the list goes on. And surgical care touches on each of these. The question is, how do we manage the massive amounts of funding that could potentially come this way to deal with these issues? And how do we manage funding mechanisms that will ensure that these goals are achieved in a way we envision, a sustainable way. And I believe we can learn from the success of organizations like the Global Fund and Gavi. The concept of pooling resources for greater impact has worked very well for achieving their impact targets. Now, they've also implemented robust methods of monitoring and evaluation for impact, and they've also learned over the years of what works and what does not work. So instead of reinventing the wheel, I think it's a good idea to take what has already been established and successful and use it in the unique way for the global surgery community. So I believe that we as a global surgery community have the opportunity to build similar funding mechanisms unique for the context of surgical care, for achieving the goals that we're talking about. That is, shaping resilient healthcare systems that are built on the cornerstone foundation of strong surgical care. And that will help us better deal with emergencies like the pandemic.
I think global surgery is entering a new era. And I think we can no longer say that we're the neglected stepchild. I think now we're the poor cousin. And the reason I say that is you can't claim that you're the neglected stepchild when all of the SOTIC health ministers have passed a resolution that says, you know, surgical capacity should be part of national health plan. You can't say that when the Pacific Island, 22 ministers of health in the Pacific Island have said national surgical strategic planning should be part of national health planning. But where we haven't gone is to capital and to attract capital flows. So I think we need to continue with the concept of integrating surgical capacity into national health planning, yes, but we need to talk about how do we attract capital from impact investors, from venture capital, from private equity, from industry. I mean, obviously, of course, you know, governments have to make the primary decision, and Jim Kim said that. Countries have to demand that surgery is a priority, and of course that's true. But if countries, and if we want to see capital flow towards investment in surgeries, we have to change our arguments. So we've been operating as if we're the neglected stepchild, and we have to shift our arguments to attract capital.
Great.
Let's remember the fundamental moral imperative. 20 years ago, if you had HIV virus in a rich country, you very likely survived. And if you were in a poor country, you almost certainly developed AIDS and died. That's what we're seeing right now in global with surgical procedures. People in rich countries have access to needed and life-saving surgery, and those in poorer countries don't. But in some ways, surgery is easier. There's no stigma attached to correcting a deformity or removing a tumor. And once it's done, there's usually no need to remain on medication for the rest of your life. So a national surgical plan should be able to calculate resources, measure results, and get it done with a lot of buy-in from all of the stakeholders who are needed.
And I just want to reiterate on some of the things that have already been said, and I'll just say it in a few words. Partnership, collaboration, and I'll end with something that Nema touches on, and that's my strong conviction that this whole process has to be led by people on the field, not by people in high-income countries and a top-down approach. We need to have people in the driving seat, driving the agendas where it matters. And so for all of the listeners, I would encourage you to become a champion in your home country and to start the process there. Be the leaders that we need in this collaborative process. So I'll end with that. Thank you.
Summarize what I said before, but first, I agree with all the things that the panelists have said. And of course, equity and reaching out to vulnerable populations, that's why we're here. In order to get to some of those goals, though, I think we need to get out of our comfort zone. We need to proactively work with capital markets, with financial markets, and we need to proactively work with the pandemic preparedness community. And I think that's really going to be critical in the next 2 to 3 years.